China is starting to put more stringent guidelines for protecting workers than something we have here. You can die from just breathing regular air in China, but yet in hospitals, they're now mandating monitoring all of these chemicals. So we have a new R&D project because we have to actually filter out all this other crappy air. So the specificity that's required is actually quite a technical achievement. We're in the lab developing filter technologies to filter out all the carbon monoxide in the air so we can monitor the ethylene oxide.
Millions of patients undergo surgical procedures every single day. They place their lives in the hands of healthcare providers who are committed to delivering safe, functional and sterile instrumentation for every surgery. Working behind the scenes are the technicians who go largely unknown, even to the patients whose lives are so dramatically impacted by their work. This is Beyond Clean, the global voice of sterile processing. Join us as we explore this hidden world and introduce you to the unsung heroes who are driving the advancement of our profession. And now your hosts, Justin Poulin, Michael Matthews, and Hank Balch.
This week on Beyond Clean, we speak with David Hilliker, President and CEO of ChemDAC Incorporated. David's role is focused on developing the business through international partnerships and domestic market expansion, as well as driving research and development to deliver the next generation of reliable gas detection technology. David has dedicated his career to developing and bringing to the market the best technology available for detecting and measuring levels of peracetic acid, hydrogen peroxide, ethylene oxide vapors in the air. Gentlemen, I will say, I think this focus on this show around employee health and safety is one that is going to be widely surprising and also needed as far as starting a conversation in the industry.
That's so true, Justin. And I'll say there are a number of companies out there that focus on safety, but typically that safety focus stops in the decontamination area. A lot of focus on PPE. We have the right gowns, right gloves, right mask, but then you jump over to the clean side, in particular the sterilization area, and who's watching that? That's the topic that we're going to cover on this episode. I think, like you said, there's going to be a lot of surprises that come out of it, and hopefully some actionable education for the folks out there in the trenches who are wanting to keep their people safe.
Yeah, and that's really what I think this is all going to really revolve around is the people. You know, we've all been in the industry for a pretty long time and built some long-standing relationships with coworkers and employees, and the idea that we could be inadvertently exposing ourselves and our friends to pretty dangerous stuff is kind of scary. And so the opportunity to be able to protect people that we care very deeply about on an everyday basis is something that I'm really looking forward to learning more about.
Seems like in the industry that patient safety has always moved the needle. I think it's time that employee safety moves the needle a little bit further as well. As a reminder, you can subscribe to Beyond Clean on iTunes, Stitcher, Google Play, and Spotify, or search for Beyond Clean on your favorite podcast application. We can also be heard on the Sterile Education app, available on iTunes and Android. Don't forget to visit us at the ISHM Annual Conference and Expo. You can find us at booth number 256, and we're hosting our second annual myth-busting panel discussion on Monday night. Register now at beyondclean.net as space is limited. Follow Beyond Clean on Twitter at Beyond Clean Info, Facebook.com/Beyond Clean Podcast, or LinkedIn.com/company/Beyond Clean. Our Instagram is Beyond Clean Podcast, and if you have feedback for the show, a recommendation for a future topic or guest, send an email to info@beyondclean.net. This re-release of a Season 1 episode, now for CE credits, is brought to you by Anderson Products. Superbugs are evolving quickly. Is your infection control keeping up? Introducing the new FDA-cleared EO Gas 4, combining the proven reliability of ETO sterilization with a new high-efficiency microdose technology. produces zero emissions to the environment, manufactured here in the U.S. with over 5,000 Anderson sterilization systems in use worldwide. Learn more at anpro.com. That's ANPRO.com. We'll be right back after a short break. Beyond Clean. Joining us now is David Hilliker, President and CEO of ChemDAC Incorporated. David, thanks for coming on the podcast.
Well, thanks for having me. Wonderful to be with you.
I think in the first segment, we want to get into the what and the whys of chemical monitoring. Why don't you start by just telling us about the genesis of ChemDAC and give everybody a definition so that they understand chemical monitoring?
Well, the genesis of ChemDAC, I think, is like a lot of new businesses or new endeavors. It came out of a need. Back in the late 90s, when ethylene oxide was really still the gold standard in the industry, we recognized that there were extreme enclosure risks. And the regulatory environment was starting to get more and more kind of in tune with that as well. So, as a company, you look for things that you can do to meet a need. The first thing is to understand that need. And ethylene oxide, as I mentioned, was the gold standard. And back then, the chambers were pressurized chambers. So if there was any leakage of the chemical or the gas, it would leak out of the sterilizer. And that was changing because I think it was recognized that there was a lot of failures and there could be more exposure than people knew. The other side of that was there weren't any really good methodologies or good equipment that could monitor ethylene oxide. The biggest problem was that there were no sensors that could differentiate between alcohol and ethylene oxide. So we know how much alcohol is potentially used in sterile processing, so there'd be a lot of false alarms, and then people would end up just unplugging the monitoring system because it just wasn't accurate enough. We recognized that, and we set out to develop a monitoring system to keep people safe from overexposure to ethylene oxide, and the biggest challenge to overcome was to create some specificity in that sensor. And so that's what we did. We worked for several years to perfect a sensor that wouldn't basically give false alarms.
In terms of sterile processing departments today, you talked about this kind of kicking off maybe in the 90s, or at least the focus of defining what chemical monitoring can look like with a technological aspect, I guess, that's equal to the challenge. But in today's SPD departments, would you say that overall we're safe when it comes to chemical monitoring?
Absolutely not. Unfortunately, there's been a lot of misconception with respect to some of the new chemicals that are being used. A lot of folks that are in sterile processing today really never dealt with ethylene oxide. All they know is that it was this terrible chemical that was found to be cancer-causing, and couldn't see it, smell it, or taste it, and so you didn't know whether you were being exposed or not. When we developed that monitoring system for ethylene oxide, it was going through the change. A lot of people wanted to get rid of ETO because of it had a lot more to do with the financial aspect of it, because ethylene oxide is such a long process. It takes a short time to do the sterilization, but it takes several hours for it to off-gas and get all of that gas back out of the packaging and out of the product itself. So nobody disputes that ethylene oxide is the most effective sterilant known to man, but it's the least efficient. So really the impetus to move from, for instance, ethylene oxide to hydrogen peroxide, whether it be gas plasma or vapor phase hydrogen peroxide, was more of a financial one, more of a faster process, faster throughput. But those products were also positioned, from a marketing standpoint, positioned as much, much safer. And that is just absolutely not true. It really isn't, because the biggest misconception with hydrogen peroxide is that somehow it's this chemical that everybody knows about, right? Women, use it to bleach their hair. You buy it at the grocery store in the brown bottle. And that is just a terrible misconception, because the concentration used in today's hydrogen peroxide sterilizers begins at 58%. It actually goes all the way up sometimes to over 90%, 95% hydrogen peroxide. That's called a monopropellant. That's rocket fuel. That is it's extremely dangerous and volatile. Comparing it to ethylene oxide, there's no smell. So you don't even know if that sterilizer potentially putting out exposure of that chemical over the permissible exposure limit. Now, that's the other comparison. The exposure limit for hydrogen peroxide, whether it be gas plasma or vaporized hydrogen peroxide, is exactly the same as ethylene oxide. It's 1 part per million. That's the permissible exposure limit for exposure to hydrogen peroxide and ethylene oxide. Now, the ideal H, the immediately dangerous to life and health level for ethylene oxide, somewhere between 700 and 800 parts per million. Hydrogen peroxide, 75. So it's a magnitude of 10 times lower of an exposure that's immediately dangerous to your life and health. And what the ideal H means, and that's a NIOSH term, an exposure limit, what that means is irreparable health effects. So if you're exposed to 75 parts per million, it could potentially cause irreparable harm to you. That's the thing that is really difficult for the position that we're in. We make monitoring systems for hydrogen peroxide, for ethylene oxide, and for some of the liquid chemical sterilants, parasitic acid. And all of these chemicals are designed to kill all pathogens. That's what they do. If they weren't, hazardous, they wouldn't be effective. When you look at the regulatory landscape, call it, in general, healthcare, for some reason, has been allowed to self-police. And there's not a lot of pressure from regulatory, from OSHA specifically, in sterile processing for those chemicals. There's a lot written, there's a lot of exposure limits and things like that, but there's not a lot of enforcement at all.
You mentioned NIOSH. Can you define a little bit about who they are and the place they have in this whole conversation?
NIOSH is the National Institute of Occupational Safety and Health. Let me back up. In 1970, President Richard Nixon signed the Occupational Safety and Health Act, which created 2 agencies, NIOSH, the National Institute of Occupational Safety and Health, and OSHA, the Occupational Safety and Health Administration. NIOSH was charged with doing research and development of exposure limits to keep people safe, occupational exposure limits, and OSHA was the administrative or the enforcement agency. Unfortunately, they have been severely underfunded, and since 1970, there's only been a handful, 48 years? There's only been a handful of new exposure limits. Most of the exposure limits that are currently used today and are recognized were created by the American Conference of Governmental Industrial Hygienists, or ACGIH, who were founded in 1938. In 1970, with that Occupational Safety and Health Act, they adopted all of the current exposure limits from ACGIH. And as I mentioned, since then, it's been a real uphill battle. The funding hasn't been there. They just don't have the resources. It's kind of like the street light theory. You don't get a street light until at least 3 people are in an accident or are killed. Unfortunately, that's the way things are with these regulatory agencies. They don't have the resources. So they have to prioritize. They have to kind of focus on the things that are kind of the most important. I'm not sure how they come to that conclusion sometimes. For instance, I can give you a great for instance right now, parasitic acid. PAA, as you all know in sterile processing, is used extensively now in AERs, automated endoscope reprocessors. PAA is under very, very tight scrutiny right now with NIOSH and OSHA. They're developing exposure limits because the chemical is growing in all kinds of applications in all kinds of industries. In fact, I'm here in Branson, Missouri, because I'm giving a talk tomorrow to the Chicken Federation. And these are folks that process millions and millions of chickens, believe it or not, using parasitic acid to control things like listeria and salmonella and things like that. The same chemical that you're using in sterile processing to sterilize instruments. And for the same reason, because it kills the pathogens and it leaves no residuals on either the instrument or the carcass of the bird that they're processing that we're all eating. So in one way, parasitic acid is in healthcare is used for infection control, and in our food system, it's used to prevent foodborne illnesses. As I said, right now, OSHA, NIOSH, and ACGIH, in fact, are all developing exposure limits for parasitic acid because of the potential health risks associated with it.
We've talked a little bit about the specific chemicals that really are in need of monitoring. I know that anybody who has ever watched, daytime TV, you've probably seen an ad for calling your lawyers for mesothelioma, for asbestos exposure, because at one time that was seen like as like absolutely the best insulation you could get was asbestos.
Absolutely.
And then sure enough, later we find out we're killing people left and right. So, I'm an SPD manager, and I would really like to know, what are the specific health risks that we're being exposed to on a regular basis?
That's a great question. All of these chemicals are biocides, okay? Bio means life, side, C-I-D-E, means kill. So all these chemicals are designed to kill as efficiently and effectively as possible, right? And that's why we use them. That's why they're so effective in these applications. The route of exposure, for instance, for parasitic acid, hydrogen peroxide, ethylene oxide, most of it is inhalation. So you're talking about damage to the lungs, damage to the neural system. I can tell you that ethylene oxide was used for 50 or 60 years before it was determined to be a carcinogen. And that's where hydrogen peroxide is right now. It's a known animal carcinogen. Hydrogen peroxide is. A lot of people don't know that. That's ACGIH. It's a known animal carcinogen. It's a mutagen. These are all very serious things, of course, but these are things that are cumulative. The risk is that you don't know what you don't know. You don't know what you're breathing every day. Now think about it. You go to work every day and you work around these toxic chemicals. It doesn't cost a lot of money. And, I'm obviously, my position as the founder, president, and CEO of ChemDAC, a company that manufactures gas monitoring systems or vapor monitoring systems. Of course, that's my business, and I want to sell that. But that's not what drives us. That's not what drives this company. This company is all about keeping workers safe. The interesting thing that happens is when you focus on that, you learn a lot. You learn more than anybody else knows because they don't have time. And it's not their business. They work around it, but it's not something they're going to think about a lot. It's up to the leadership, quite frankly. It's up to the leadership to recognize that these chemicals are designed to kill. Let's be real. Equipment can and does sometimes fail. These sterilizers can and do leak. We've put out many studies and many articles. In fact, last year, we worked directly with Advanced Sterilization Products to do a study on their competitor, Steris, the vPro. We worked together. They funded it. And we did a report that the vPro, in fact, put out potentially, actually, the ones that we tested a variety of them, and we found some very high exposures, certainly higher than people would like to be breathing, and certainly higher than the exposure limits. Steris ended up doing the same thing and wrote an article to talk about the other guy's sterilizer can leak as well. And that was another study that we had performed. And others have performed. It's not just us. I mean, there's been a Japanese study. There's been some other resources besides this. The point being that, and I have to give Steris a lot of credit. Last year in the communique, one of the self-study guides that they did actually concluded or said that you should be monitoring these chemicals, including their hydrogen peroxide sterilizers, 24/7. They literally said that in their study guide, and that was the right thing to do. Unfortunately, we still don't have a lot of acceptance or compliance even, you can use that term, because it is a legal exposure limits for these things. If you're not monitoring, you have no idea, especially hydrogen peroxide and ethylene oxide. You have no idea because you can't smell it.
In this context, then, with, laying it out on the table as you have, and also, like Mike said, having been a leader in these departments on the front line, utilizing all of the equipment that we've been listing so far, and then being moved to say, okay, I agree. There's some problems here. There's opportunity to keep our people safer than we're keeping them today. And yet, as leaders, we still have to be able to make the financial case for these systems. Can you give us a couple of tips to share out to the audience to help to at least start that process of convincing administrators where money's already tight and we've already been doing this for 10, 20 years the same way? Why spend money to monitor it now?
That is a significant hurdle, and it really always has been in this industry for whatever reason. If you go into industry, it's completely different. The money is there. They spend it. I think it's because there's much more enforcement in the industrial applications. I mean, even ethylene oxide, you go into a medical device manufacturer, every single one of them have always had EO monitoring. There was never any question, even before it was, under the spotlight. Same thing in industrial applications with hydrogen peroxide or now parasitic acid. The financial case is one that's always been difficult in healthcare, and I think it goes back to what I said earlier. Somehow it's been acceptable that healthcare has been self-policing. There's not a lot of regulatory pressure for chemicals in healthcare for whatever reason. So, but more to your point, there's an organization called NORA, National Occupational Research Agenda. It's part of NIOSH, the National Institute of Occupational Safety and Health. They did a study, and the study showed that of all of the occupational sectors out there, agriculture, construction, I believe even police work and things like that were in there. Do you know what the highest rate of injury and illness was in healthcare? Overall, if you think about, what we're doing, these people are subjected to a lot of different risks. And one of the things that they pointed out in that study was this nobility issue. People from nursing on down, doctors, nurses, technicians, everybody, there seems to be this acceptance with taking undue risk for the benefit of the patient.
It's funny that you bring that up because we spoke with a prior guest who had a background in law enforcement, and we talked about this phenomenon in that interview and said, isn't it funny how people in nursing or people in more public service type activities think because I'm doing something that's noble, I'm almost invincible or I'm protected because of that, and it's just simply not true.
Or they feel like it's noble to take the additional risk. And a lot of times it's an unacceptable, unacceptable is not the right word, it's not necessary. That same NORA report talks about that nobility, that's a real thing, and then it talks about the fact that it can be prevented. Let's say that they don't speak up. People don't speak up because they think it's okay for me to take this additional risk. I'm doing it for this noble cause. And don't we drill that into people in healthcare too? I mean, quite frankly, we kind of support that narrative, don't we? I don't know about you guys, but I think you and everybody else in healthcare are superheroes to me. They go to work every day and they take these risks. They're around all of this chemicals and these sharps and these, these diseases, and it just goes on and on and on. I have the highest respect for those people, and that's kind of what drives our company. We want to protect people from the known
from themselves
that we believe that they're taking. Well,
really, no, think about it, from themselves and that phenomenon that you just described in many ways. And it is scary to think that many manufacturers are already protecting their employees and have been for many years with this type of monitoring, and yet we don't have that in the healthcare industry. So I think we need to dive into in segment 2 how the technology works, how it can protect employees and drive safety and health factors, and increasing that sense of confidence that they aren't getting exposure while on the job. So we'll be right back after a quick break. We're back with David Hilliker, President and CEO of ChemDAC Incorporated. And we left segment 1 pretty passionately talking about some of the phenomena in the industry, standards or double standards even for chemical monitoring. I think we need to let the listener know how the technology actually works in a CS department and maybe even compare it to existing safety protocols. So start by just explaining how this works and what kind of data is being gathered, David.
Well, our monitors are all continuous real-time monitors. And you can compare that to kind of another gold standard, the Dosimeter Badges. They use them in radiology too for protect them from getting too much radiological exposure. But the way those work, of course, is that you wear them for a period of time, either 8 hours or 15 minutes or whatever, depending on what the exposure limits are. And then you package them up and you send them away. And about a week later, they'll let you know if you're exposed or not. I always thought that was just incredibly odd, quite frankly. You end up being the monitor. You're the one that's getting this exposure, and then you're not being made aware of it until this is analyzed and it was sent back to you. It's a rear view mirror, and so that's not what we want. What we want is more like a predictive situation, and that's what the ChemDAC monitors do. They continuously monitor the air right at the potential source of the leak. So this would be at the door of the sterilizer, for instance, the STERAD or the V-Pro, if it's hydrogen peroxide, or the 3M or the Steris ethylene oxide sterilizer, the 5XL or 8XL, or in the 3M parlance, and then it's right above the door and right at the potential source of the leak. Now, let me separate these. With ethylene oxide, the biggest catastrophic risk, of course, is those cartridges of 100% liquid ethylene oxide. Because if you get a pinhole leak in that, you got hundreds of thousands of parts per million leaking out of that into your breathing zone. So you want to put a monitor or a sensor in that storage cabinet because they do leak. And you want to know before you open that storage cabinet up that if something's leaking, because it'll just, then all come out. Again, you may not even smell it if it's under 700, but the exposure limit's 1. Ethylene oxide is a little bit of a different protocol. You want a sensor on the sterilizer when you're storing it. But again, the monitors give you a current reading. So what we train people to do is you put the sensor right above the sterilizer door. If there's any exposure chemical, you'll see it. Most of the time when you open the door, you see momentary spurts of sometimes pretty high levels. The monitor actually shows the reading, the current level of the target chemical, whether it's hydrogen peroxide or peracetic acid or ethylene oxide. What we teach people to do is open the door and step back a few feet and look at the monitor. Make sure that monitor is at 0 before you go reaching into that sterilizer. It's actually a way for them to understand what the equipment is, and it's a best practice. We found that the people who are using our equipment come to appreciate that because not only do they see what's going on, they basically can relate if they didn't have that monitor, they'd be sticking their head in there, taking those items out, and they'd be breathing it. Sometimes, 8, 10, 12 times the permissible exposure limit. The difference between ethylene oxide and hydrogen peroxide as well, as people are so afraid of ethylene oxide now, they don't realize that back in the day, they'd only interact with that machine, once every 12 hours, right? They'd put it in, they'd turn it on, and then they'd go 12 hours later and take it out. How many times in a busy sterilization department are you going into a STERAD or a V-Pro? I mean, it could be every 20 minutes, 20, 30 minutes throughout the day. So you're potentially repeatedly exposed all day long, as opposed to ethylene oxide. Now, that's not to say that machine couldn't leak, during the cycle as well. But people aren't standing at the equipment, at the ethylene oxide sterilizer all day. And these days, most of them are in dedicated rooms. Our equipment is continuous monitoring, but it goes one step further. I mentioned it earlier, predictive. Hydrogen peroxide has an 8-hour time-weighted average exposure not to exceed 1 part per million. What our monitor does, and there's also a short-term exposure limit, by the way, in a couple of states, only a couple of states in the U.S., I think it's Washington and Hawaii, of all states, have a 2 part per million short-term exposure limit for hydrogen peroxide. They've recognized that it's that dangerous that they need to have that as well. So our monitors actually monitor both the 8-hour and the 15-minute. By predictive, what I mean is that it's continuously calculating a 15-minute and an 8-hour average exposure. So if during that time period it goes over the preset limit, it will give you a warning. Or I'm sorry, if it's approaching, that's the predictive part of it. So if it's approaching, being over 2 for 15 minutes or over 1 for 8 hours, it's going to warn you, it's going to alert you before it gets to that level. Because think about it, at that level, you're overexposed. Now it's like the badge again. It's already happened. I think that the great thing about our equipment is it monitors the environment continuously. You don't have to think about it, but when you need to know that it's starting to be a potentially dangerous situation, it starts giving you an alert. And then, of course, if anything's exceeded, it's an alarm at that point, and it'll give you an alarm, sound. That's part of the training we give it with the equipment. I can make an announcement right now. We are going to be releasing our newest monitor, the SteriTrack 2 and 2 Plus, at this year's ISHM conference. And some of the neat things that are on this new system, we've taken away a lot of the installation cost. So instead of mounting this on the wall and wiring it, the system is totally wireless, and the display is mounted right actually on the sterilizer with the sensor above the door. So they literally can see as they're working with the equipment what the levels are and where they are in the process, and or if there is any cumulative exposure or anything like that. So you've heard it here first. We will be introducing our newest, and I think it's our 4th generation monitoring system. A lot of neat improvements. Right now, our monitors are tied. If you have multiple monitors on multiple pieces of equipment, even multiple gases, it can all come back to one central display, and all the data and everything is stored on that display. It's actually a computer. Now, the SteriTrack 2s and 2 Pluses will actually have all of that data stored right in the monitor at the location. So you could literally just store that data there. And part of the OSHA guidelines are that you keep this data. You're supposed to be able to show that you're meeting these requirements. You're not overexposing your workers. So it's really required, this data, to have. I think you guys will appreciate this. Similar to mammograms, you can use this data over time to much better understand the cause and effect. That's what's not happening in healthcare. People become ill, healthcare workers, and they don't relate it to the potential exposure that they've had over the many years that they've spent in sterile processing. That's where we're missing it. That's why they want people to get mammograms, because you can do trending. You can understand better why things are happening. What exposures are these people subjected to? If you don't have the data, and I always like to say, if you can't manage what you don't measure. So if you don't have the data, you cannot come to any kind of a conclusion. A couple of years ago, there was a new regulation, and it was called the Hazard Communication Standard. And it was mandatory for all businesses. Didn't matter who it was. My company had to do it. I had to train all of my employees because they work around chemicals. I had to train them on the Hazard Communication Standard. I went all across the country speaking at regional ISHM organizations, or, the different conferences and everything. I must have gone to a dozen or 15 of them. And I spoke on the Hazard Communication Standard, and it was mandatory by the end of 2015 that everybody be trained. And we actually handed out a guide. Literally, we handed out a CD that if you just fill in the blanks, you would have what was required. You would have everything that the standard said that you had to have, including the safety data sheets and just everything, including, and by the way, part of that said that people had to have a means to let people know, to inform people if they're overexposed, which, how do you do that? You have to monitor it. So that was our intention, to go out and teach people this.
Along the lines of, the monitoring and the good catches, do you have real world examples of putting in your technology and it catching something that could be potentially protecting technicians' lives?
If you look on our website, chemdac.com, and go into the blogs, you'll see that there's been times where people have bought the system. Great, kudos to them. We've gone to install it, and when we install it, we also do in-services, teach them how to use it and how to get the most out of it and all of that. There have been many times where the very first time we've set the system up, they run a load, and I'll be darned, they open the door and 8 parts per million. And as they have been reaching into that thing for God knows how long, breathing that. So that's exactly the kind of thing that we're trying to say.
Let me ask you, David, you just said parts per million. When you say that, is it repeated exposure over and over and over that results, or is it a spike at any time that exceeds a certain amount that actually will lead to the complications. Do you see what I'm getting at? So like if you had one person who was always, I'm going to be the person who's unloading the machine, but let's say their exposure was a lot smaller for whatever reason, but then somebody comes over and the parts per million is way higher to that one person, who's actually at more risk, or do we not even have that data? Because you said before, data is the real key here in making all decisions in healthcare, and you're preaching to the choir on that one.
If you think about it, it's subjective. Here's the thing. There's the different chemicals have different hazardous properties. They're different hazards to our bodies. Ethylene oxide is now a known carcinogen. For 60 years, it wasn't. Okay, for that last 10 years, it was a suspected animal carcinogen. And then it went from that to being a full-blown carcinogen. Now, the only way that happened is because pressure was put on NIOSH and OSHA to do the research and come to that conclusion. They just don't have the resources to do that with everything. This exposure limit for hydrogen peroxide was back in the 40s. I think they came up with that exposure limit. It hasn't been revisited, and it's an ACGIH, again, the American Conference of Governmental Industrial Hygienists, says it's a known animal carcinogen. So that's where ethylene oxide was 20 years ago. Here's another thing I think that'll help answer your question. There is no exposure acceptable at all for a carcinogen. In other words, it doesn't matter if it's 1 part per billion, especially from a reproductive standpoint. And it's not just women. Men can be just as affected from a reproductive standpoint with these biocides than women can. I think on our website we have an article that was done by an international peer-reviewed environmental safety magazine, Occupational Safety and Health magazine. And it put out that article. It said there is no safe level. Even though it says ethylene oxide is 1 part per million, it's a carcinogen. From a reproductive standpoint, there is no safe level. So you shouldn't get any, ever. So when you ask the question, is it the guy or the gal that's doing this every day? Well, I'd say absolutely they're probably more at risk than the person that, occasionally goes and works around that equipment. But think about the person in the GI lab or the person in CS if you do a lot of GI, if you do a lot of endoscopes down there and you're using parasitic acid. Day after day, that's their job. Day after day after day, they're plugging that thing in and winding it up and sticking it in there and running that thing with parasitic acid, who we now know just recently how dangerous it is from a health and safety standpoint. Right now, for parasitic acid, NIOSH, again, the National Institute of Occupational Safety and Health, they're trying to come out with an immediately dangerous to life and health level. We have the only sensor, by the way, in the world that detects this at the levels that they are saying is dangerous. So ChemDAC was literally invited to Washington, D.C. to sit down with the highest levels of NIOSH and dispute what that level should be or argue it, because we're the only company in the world that has data. So they're trying to say a 0.5 part per million should be immediately dangerous to life and health. Well, we've been monitoring PAA in a filling plant bottling a dairy drink for 5 years, and their average exposures, has been way over 0.5. And so we argued that that's too low. We can prove it. But since then, now OSHA has gotten involved, and they're trying to come out with a permissible exposure limit. That's an 8-hour exposure limit, a time-weighted average exposure limit. And the American Conference of Governmental Industrial Hygienists have come out with a short-term exposure limit at 0.4. These exposure limits, sub-ppm exposure limits are, it's nothing. It's extremely low. And they're saying that anything over that is potentially, hazardous to your health. And to get back to the specifics, for parasitic acid, it's like glutaraldehyde, occupational asthmas, severe itching and rashes. They're primary irritants, so eye, nose, throat, all that stuff. And, of course, pulmonary edema. So you could, water could build up in your lungs, and you could just fall out that way. So, there's no lack of scary stuff.
Well, it starts to sound like a pharmaceutical ad, right? In the middle of the Super Bowl. All these side effects that just get listed out and people don't necessarily take it seriously, is what I'm getting at. And I think it is very important that we take it seriously.
Because it's the fine print, right? It's the fine print down at the bottom of or it's the guy that says it's super fast, right? At the end of the, hey, this is going to save your life, but by the way, it can kill you. It can, make you sterile. It can, they just go on and on. Nobody really sits there and says, well, what are the risks and rewards of this? That's a whole nother topic.
Well, David, we're just about out of time, but I wanted to, again, thank you for coming on the show and also say, it sounds like we have a lot of opportunity here to make healthcare much safer, through gathering data. And I would imagine by gathering this information, we might be able to make some of those cause and effect relationships in aggregate, not just protect employee safety on a day-to-day basis, but to really see how those things tie in over longitudinal studies as well.
Absolutely, and that's how we learn and we improve and we grow in these areas. And we're just hoping that more and more folks hear the message, and that at the end of the day, we don't want healthcare workers to end up as patients. And again, the connection has not been made because we're not making it. Number one, we're not tracking it. You can't manage what you don't measure. When I went talking throughout the country on the hazard communication or the talks that I do on chemical exposure, I don't think there's been more than one time or two times maybe in the whole 20 years I've been doing this that somebody didn't come up to me after my talk and say, you know what, we've had kind of a cluster of this or that or the other thing. For a long time in the early days, it was everybody seemed to know somebody that had cancer in sterile processing, working around ethylene oxide. We don't want this to go another 40 or 50 years and have all of this stuff start coming out when it's a very simple thing to do right now. We know it's hazardous. We know it's dangerous. If it wasn't, it wouldn't work. It wouldn't kill microorganisms. All we need to do is spend a little bit of money and a little bit of training and monitor this equipment. And then, as you suggested, use that data to complete the picture.
Yeah, it's necessary. I'm really glad we had this opportunity to introduce your company to the listeners for those who aren't familiar, and would definitely encourage them to check out more, and just wanted to thank you again for coming on the show.
Well, thank you. It was my pleasure. I really appreciate it.
That was David Hilliker, President and CEO of ChemDAC Incorporated. Gentlemen, I definitely liked the reemergence of the theme around what I'm going to term the noble cause exception phenomena in healthcare that we discussed with Don Williams several interviews back because of his background in law enforcement before working in sterile processing. A lot of good topics in this interview, definitely some far-reaching themes on a day-to-day basis. I don't know that we've focused as much on any interview in the past around employee health and safety, but obviously that is a huge concern for all of the technicians and managers, supervisors out there that listen to Beyond Clean every single week.
Well, it certainly is now if it wasn't before. He was exactly right where he said that everybody is, terrified of ethylene oxide. We're well aware of the dangers of ethylene oxide, and yet, no one has talked about the dangers of hydrogen peroxide or peracetic acid. These are very real dangers that are in our departments right now and that we are exposed to and our technicians are exposed to.
Just like in a lot of these topics, guys, there's existing questions in the industry and existing confusion. There's not a lot of folks who are looking at the whole outlay of the land and saying, hey, there are some serious answers here and there's serious data to back it up. And that was another thing that has come up again and again on the show is the need not only to have department level data, but to be looking at these data points from a big data perspective. And as you said, Justin, really start to set the trends here, tell the larger story over a longer period of time at equipment, that are maybe different ages, different life cycles. A hugely important conversation, and very excited to get this out to the masses.
I think this is a conversation that we'll see come up again and again in the coming months and years. And as you know, there are many guests that we've spoken to over the first 6 months of this podcast that we intend to invite back. Something tells me we'll be hearing from David again. That's going to do it for this week's show. As a reminder, you can help support us by subscribing to Beyond Clean on iTunes and Stitcher. We'd appreciate a rating and a review. Your feedback is important to the show. And if you do have any topics that you would like us to cover in the future, or if you would like to share a picture anonymously on our Instagram page, just send an email to info@beyondclean.net. On behalf of Hank, Mike, and myself, thank you for listening to another edition of Beyond Clean.